Put simply, our health care problem is our deficit problem. Nothing else even comes close. I will not sign it if it adds one dime to the deficit, now or in the future, period. The public option is only a means to that end. And we should remain open to other ideas that accomplish our ultimate goal.
My bad, that was from last night, obviously. But did he make his case? Joining us with their respective reviews of this, Representative Jan Schakowsky of Illinois. She is the Chief Deputy Whip. And we have Representative Mike Pence of Indiana, who's the chair of the Republican Conference. Thank you both for joining us today. Thank you for being with us here.
Thank you.
Representative Schakowsky, what do we know today about the president's health care reform package that we didn't know before last night? What's new now?
Well, there's a lot of things new, not so much the facts that have been in the bill, but I think now he's communicated those. I think he was able to bust some of the myths that have been going around, but even more...
Like what? I mean, I'm looking for specifics that we can point to and say, okay, we have a better idea now of how the president wants to achieve health care reform. What did he tell us?
I'm not sure that all Americans were aware that it will be against the law to exclude people for pre-existing conditions, that the fear of losing your health care when you lose your job is over now. I think that people may have fallen prey, some seniors, to the feeling that Medicare would be eroded or that there would be death panels. So I believe that he did a good job of both the positive, what's in the bill and what's not in the bill. But I think more importantly, he lifted it to a new level at the end, not just a program, but actually it is about the character of the American people and a moral issue.
Okay. Representative Pence, when you look at the way healthcare stocks are trading today, and when you read a Wall Street analysis of the speech, they're suggesting that, in fact, he didn't make the sale, public option unlikely, that if anything gets passed, and that's an if, it's going to be something moderate. Can you reassure Wall Street that they are accurate in that assessment?
Well, no, I really can't. I have too much respect for Jan and her legislative abilities and those of Speaker Nancy Pelosi.
But did you hear anything that's going to make you support this?
No, this was one more speech about the same bad plan. The president basically outlined a plan that has at its centerpiece a government-run insurance program that will set us on a pathway toward a government takeover, because the minute that the federal government starts to offer a public health insurance plan to employers across this country, and as the Democrat bill suggests, only ask them to pay 8% of payroll, and then they don't have to offer health insurance, I think you're going to see millions of companies in this difficult economy around the country cancel the health insurance plans that they have and send people to the federal program. That is going to send us on a pathway toward a government takeover. Okay. And the idea that it won't add to the deficit is just not credible.
Representative Schakowsky, you know, I mean, the so-called public option has, as we all know, been a lightning rod for the critics to this point.
It has, and this is false.
The president has said that it's not that important in terms of being a centerpiece. It's not a deal breaker. But otherwise, how do you provide the kind of competition to the health insurers to ensure the costs will come down as the president wants it to happen, if it's not a public option?
Okay, first of all, let me make it clear that even if employers were to drop their insurance, the employees would have a choice of an array of private plans and one public option. As the president said, initially, at least, there would be a very small number of people. He made the analogy between private universities and public universities. They exist side by side. The insurance industry, yes, they may have to change their ways a bit. They can thrive and survive next to a public plan, just one public plan.
Representative Pence, I want you to listen to the soundbite from the president last night. If we could play this, I want you to get your assessment of his tone when it came to the health insurance companies.
Without competition, the price of insurance goes up and quality goes down. And it makes it easier for insurance companies to treat their customers badly by cherry-picking the healthiest individuals and trying to drop the sickest, by overcharging small businesses who have no leverage, and by jacking up rates.
It seemed to some that there was a bit of a demonization of health insurance companies, their representative. Is that constructive to the debate?
Well, I don't believe it is. It's insurance companies are a pretty, a pretty big target. in the political debate, but I don't think it really advances the cause.
Did he say anything that was inaccurate about the insurance companies and how they do business right now?
What he said was we need to bring competition, because the reality is, as the president correctly said, many states have a virtual monopoly where there's just one or two major health insurance companies that offer health insurance programs to businesses.
How would you provide the competition then, Congressman Pence, to help bring costs down?
Well, here's a thought. Rather than a government-managed exchange that Jan's advancing, and also a public option in that subsidized by taxpayers, why don't we just let the American people purchase health insurance across state lines the same way they purchase auto insurance? Let's not open it up to an exchange. Let's open it up to 1,300 health insurance companies, association health plans. Let's bring real competition. Let's not replace one monopoly at the state level with a brand new behemoth of a government monopoly in the future.
We're late on time, but Representative Shakowsky, you want to answer that? Would that work?
The across state lines means that we fear that insurance companies would locate in the state that has least regulations.
Bingo.
And it would be a race to the bottom.
Exactly, yes, and we would all have much cheaper choices, right? We could go to places and we could have choices about what kind of coverage, at what level, and at what prices.
And what about the protections to make sure that mammograms are covered, that certain...
you pay more for more of what you want.
No, we fear that the things that the states have actually done, states' rights to protect the consumer, would go out the window.
All right. Representative Shakowsky and Pence, thank you both for joining us. We appreciate the time.
Thank you.
Thank you.